Hello, my name is Margaret Ikpoh, and I'm the RCGP Vice Chair for Professional Development and Standards. This is a 3-year term which involves general oversight over our TRIPOS exam, which forms the MRCGP, continuing professional development, and conference planning. Prior to becoming a Vice Chair, I was my local faculty chair in Humber, and prior to that, I was the educational lead for Yorkshire. Now, my first leadership role was the educational lead role, and that was really born out of a need to try and change the status quo around the different types of CPD that were being offered in my area. I felt at that time that the CPD that was being offered wasn't really reflective of the cases that were coming through in practices, particularly around the healthcare for people who were disadvantaged in society, such as asylum seekers, patients with protected characteristics. And I thought that I could perhaps do something to change that status quo. At the time of taking up that leadership role, I never thought I could do it because I thought potentially with a young family that would be a barrier to trying to do something. But it was only a session a week, and at times I was able to work from home back then. And that was a really important lever for me to be able to get involved with CPD in my area. I did that for a few years, and then following that, because I'd really enjoyed the time that I'd spent with faculties across Yorkshire, I decided rather to stay in my own area, Humber and the Ridings, as a faculty member. I enjoyed the camaraderie that I had with people at all different career stages, and not just GPs, but our allied healthcare professionals as well, including our paramedics, our physician associates, our nurses, and lay members also that were on the board. Currently, I work as a GP partner and a trainer for almost 15 years, and I work 7 sessions a week, and I am the lead practice for research in our practice, which serves a population of around 36,000 patients. So what have I learned about my leadership journey? And it is a journey. Well, one of the first things I've learned is that it comes in all shapes and guises. As GPs, we actually make decisions as leaders all the time. When I commented on the great leadership skills demonstrated by one of my trainees recently, they said to me, goodness, I never envisaged seeing myself as a leader. I don't even know what that means as an aspiring GP. I pointed out to them that the quality improvement project they had delivered not only changed the way we practice as a team, but it changed the way we delivered the care that was needed to the communities we were serving. As GPs, we are in a privileged position because of our closeness to our communities to be able to work with them and understand what their needs are and also where the gaps in service provision are. And one of our key skills as GPs is listening. And it's imperative when you are a good leader that we listen with intent, ensuring a dose of humility along the way, as this not only helps to build trust with your colleagues, but it's important to being able to build more effective teams to help improve patient care. I've personally been fortunate to have had the support of my fellow officers and wider team, and also my faculty, where my own leadership journey started. However, I realised that my leadership journey amounts to absolutely nothing if I'm not able to support the leadership potential of others, whatever point in their career they find themselves in. Personally, I have benefited from our mentoring platform and especially our peer networking events. These have been pivotal in ensuring that we are able to offer the support we need to those that seek it. In fact, one of my mottos that I abide by as a leader is to continuously strive to improve on whatever I have done the day before. As the late great poet Maya Angelou says, because when you know better, you should do better. And that's exactly what the college endeavours to do for all its members. Thank you.